can be dangerous than the recall itself. So let's break it down. Nitrosamine impurities. These are chemical. Now the question comes, what metoprolol actually does? Let me explain you this as a pharmacist. Let's talk about why doctors prescribe this medication in the first place. In simple terms, like as in high blood pressure, heart failure, chest pain, angina, irregular heart rhythms, slower heart rate, cold hands and feet. Imagine this. You wake up in the morning, take your blood pressure pill. You have been doing it for years. Then later that day, you see a news headline that says heart medication recall. And suddenly you're thinking, wait, I take that drug. Is my medication dangerous? Should I stop taking it right now? If you or someone in your family takes metoprolol, one of the most common heart medications in the United States, this video is extremely important for you because today I'm going to explain what metoprolol recalls actually mean, whether the medication is still safe to take, and the dangerous mistakes many patients make after hearing about recalls. And trust me, stopping this medication the wrong way can be dangerous than the recall itself. So let's break it down the facts. Hi, I am Mayank, registered pharmacist with RX Indian Pharmacist channel, your go-to guide to pharmacy knowledge. If you're first time watching this video, please consider subscribing. Recently, many patients across United States have been searching, is metoprolol safe? This concern started after certain batches of generic metoprolol were recalled. And the reason? Some of the tablets failed dissolution tests, meaning they may not dissolve properly inside the body. If a medication doesn't dissolve correctly, it may not release the drug at the right speed, and that could lead to less effective blood pressure control in the body. Unstable heart rate control could cause arrhythmia as well. Another concern raised in some recalls involved nitrosamine impurities. These are chemical impurities that regulators monitor closely because the long term exposure at high level may increase cancer risk. Now, before anyone panics, here is the critical point. These recalls were not about the drug itself being unsafe. They were about specific manufacturing batches that failed the test. That's a huge difference, right? It is. So now the question comes, what metoprolol actually does? Let me explain you this as a pharmacist. Let's talk about why doctors prescribe this medication in the first place. Metoprolol belongs to a class of drug called beta blockers. Beta blockers work by blocking the effect of adrenaline on the heart. In simple terms, the medication helps. It helps to slow down your heart rate, reduce blood pressure, decrease strain on the heart muscle. Doctors prescribe metoprolol for several major conditions, like as in high blood pressure, heart failure, chest pain, angina, irregular heart rhythm, prevention after heart attack. For many patients, this medication literally reduces the risk of future heart attacks and strokes. That's why this is one of the most prescribed heart medications in the United States. Millions of Americans take it every day, and it has been used safely for decades. Understanding drug recall. When people hear the word drug recall, they often assume something extremely dangerous happened, but in reality, many pharmaceutical recalls are actually due to the quality control issues. For example, during manufacturing, regulators test medications to make sure they dissolve properly, contain the correct drug dosage, are free from harmful impurities. If a batch fails one of these checks, companies may recall that batch as a precaution. This doesn't mean every bottle of the medication is unsafe. It means a specific manufacturer or a lot number had a problem, and that is why the drug has been recalled. And the recall system exists specifically to protect patients before problem occurs. So ironically, a recall can actually be the evidence that the safety system is working. Now, let me discuss the most dangerous mistakes that some patients make. Here is something extremely important that many patients don't know. The biggest danger with metoprolol is not taking it. The biggest danger is stopping it suddenly. Beta blockers change how your heart responds to adrenaline. If you abruptly stop the medication, your body can experience what's called the rebound effects. This can cause rapid heart attacks, severe blood pressure, chest pain, increased risk of heart attacks. That's why doctors always recommend tapering the dose slowly. So, if you ever hear about a medication recall, the worst thing you can do is panic and stop your medications immediately. Instead, you could speak with your pharmacist, your treating physician, or you could speak with your healthcare provider. Common side effects patients should know. Like any medication, metoprolol can cause side effects. The most common side effects include fatigue, dizziness, slower heart rate, cold hands and feet. Some patients also report vivid dreams, mild sleep disturbance, reduced exercise tolerance. These effects usually happen because the medication is slowing the heart rate and lowering your blood pressure. Most people, these symptoms improve as body adjusts. But if symptoms become severe, your doctors may adjust the dose, switch beta blockers, or change medications entirely. Patients who need extra monitoring. Some patients need extra caution when using metoprolol. This includes people with asthma, diabetes, very slow heart rate, severe circulation disorders. For example, beta blockers can sometimes mask symptoms of low blood sugar, which is important for diabetics. This doesn't mean the medication cannot be used. It simply means closer monitoring is required. How to check if your medication is affected? So now the important question comes. If you find out that drug recall had happened, how do you make sure that your medication isn't falling that bracket? If you take metoprolol and you are worried about recalls, here is what should you do. Step number 1. Check the manufacturers listed on the prescription bottle. Step 2. Ask your pharmacist if your bottle's lot number was included in any recall. Step 3. Check the FDA recall website for updated information. And most importantly, avoid relying on viral social media posts about medication safety. Drug recalls are usually very specific to certain batches. And now, at the end, my pharmacist final verdict. So let's answer the big question. Is metoprolol safe? And the answer is, of course, yes, it is safe. Metoprolol remains a well studied and widely used medication for heart conditions. Most recent concerns were related to manufacturing issues, not to the drug itself. And the FDA recall system exists precisely to identify and remove problematic situations, problematic batches quickly. So, patients should stay informed. But there is no reason to get panic. If you or someone in your family takes blood pressure medicine or heart medications, understanding them can literally save lives. So share this video with someone who takes metoprolol. And if you like my explanation, give it a thumbs up. Subscribe to my channel RX Indian Pharmacist, your go-to guide to pharmacy knowledge. See you in another video like this next week. Until then, bye for now.